Dr. Nichelle Gurley, and I'm specialized in prenatal, postpartum, and pediatric chiropractic care, along with prenatal and postpartum fitness and rehab out of Lafayette and Louisville, Colorado. We're going to review mommy wrists. So I'm currently experiencing this, also sometimes known as mommy thumb, essentially any pain in your wrist postpartum. And this is occurring because we have so many repetitive new movements that we're doing, along with having hormones that are still affecting our ligaments, and they're still looser than they were before, so there's not as much stability. So along with repetitive movements, we also have differences in our connective tissue. Sometimes this is called de Quervain syndrome, which is where you have inflammation of the tendon in this region. And I'm going to show you a couple different things as to what causes it. So we have a lot of positions where we're doing radial deviation, where the thumb is coming up towards the elbow. So you're scooping up baby a lot like this and holding. We have a lot of wrist flexion where you're burping baby. We have that wrist flexion where sometimes people will hold baby like this and burp. We also have nursing positions where we're holding our wrist in like this, or we're holding head, doing all different positions that are either flexing, hyperextending our wrist, or putting it again into that radial deviation. So the best things that you can do is modification of activity, which is going to be one, I'm going to show you how to lift up your little one. We want to keep your wrist as much as possible neutral. So if you keep that thumb in towards your palm and keep your wrist in neutral, it's going to be the best. So as opposed to scooping up under, you can take your hand like this, scoop under the booty, and then behind your baby's head to lift them up. When you are nursing them or holding them, keep your wrist in neutral like this and hold. If you're burping them, you can, as opposed to be doing this, keep your hand like this and doing a burping. So those are a couple options for modification of activity. Rest is a huge one as well, which is something that's a little hard to do postpartum. Icing, putting on a wrist brace, and or doing taping. So this is rock tape where I've taped my wrist. And then another big one is actually seeing a chiropractor or a PT where they can be doing muscle work on your forearm. They can be doing adjustments or anything of your wrist, and they can be the one to help you tape as well.